Okay, Dr. Brad Young with Chiral Bites, little bites of information that might help you and your family out. Today we're going to talk about numbness into the little fingers here. I see that a lot, and a lot of people start thinking that this is carpal tunnel starting to form. But if it's in just these fingers, sometimes I'll see it migrate over into the middle finger, but this is the ulnar nerve. So distribution, and so the ulnar nerve comes right through here and then comes back. People call it the funny bone, and comes right through here. Now, numbness in the whole hand is different. If the whole hand is numb, you're looking for a problem from the shoulder up to the neck. If it's individual fingers, then you're looking at a problem from the shoulder down. That's usually generally how I determine where to start looking. But a big item for getting these fingers numb is a small muscle, a short head of the tricep. It is right here. If you go about an inch and a half up from this groove, you will find the short head of the tricep. And if you push on it, you should be able to elicit the numbness down the fingers. You'll feel it and you're like, oh my goodness, that is numb, it's going numb. Then you know you're on the right spot. So what you want to do is you want to take your thumb and get in there and just work out that knot. You get out pretty good. It can be very, very tender on some people. And so you work that out really good, and then you want to stretch it. To do that, you do a tricep stretch. You bring your elbow, your hand down to the back of your neck, down to your back. If you can, you grab your elbow, and then you pull and do a nice lean. So you're trying to get the angle just right to get that stretch. You hold it for a 10 count, then come back, hit it again, rub that spot out, and then stretch it again and give it a 10 count. And then you just let it relax. Give it a couple days, see if that calms down. You may have to do this about 3 or 4 times a week, but it makes a big difference. You should start noticing a difference almost immediately as you start breaking that up. I get that every once in a while, and it's when the numbness comes on, that reminds me that I gotta work that spot. So remember, rub that spot out. It's an ulnar nerve that's has pressure put on it by the short head of the tricep, and then that'll help you out quite a bit. This also helps give you grip, because the ulnar nerve not only does a sensory to these fingers, it's motor to the thumb. So this muscle right here, it's what gives it its strength. So even if you start noticing that you're having problems gripping things and twisting bottle tops off, and you just notice that your grip is very weak, hit that nerve, work that out, and you should notice that your grip starts to become stronger. So hopefully that helps you out, and I will talk to you later. Bye-bye.